Hi, I'm Paul Hobson. I'm the head of dentistry at MASH. I've been doing dentistry exclusively for about 20 years now. Chewing in dogs is a difficult subject. Dogs are really highly motivated to chew on things because in the wild, dogs chew on the long bones of their prey to get the marrow, which is a very important part of their nutrition. So essentially, dogs instinctively want to chew on hard stuff. The problem is that if you look at populations of wild dogs, they all have fractured teeth, often by a very young age, and it's often what makes an end of them. And wild dogs really only live to be 4 or 5 years old. We want our dogs to be 19 with perfect teeth. So you have to make some decisions about what to let your dog chew. Obviously, if you let them chew on things that are harder than teeth, like bricks or stag antlers, they're going to break their teeth all the time. And veterinary dentists all over the world take vacations in the Caribbean on the back of antlers being sold as dog chews. Bones are commonly given to dogs as chews. The problem with bones is they're nearly as hard as teeth are, so dogs will frequently fracture their teeth on bones. So if you have a dog and you feed them bones, you're taking a significant risk that they're going to fracture their teeth and need to have treatment for that. As you move down the scale, to get to something a dog can't fracture its tooth on, you really have to be able to indent it with your thumbnail and make an impression in it. The problem with that is, while safe, many chewy dogs are going to destroy that in 30 seconds flat and look around for what's next to chew on. So it's really an individual decision for a client, knowing who their dog is and thinking about what's available, about where on this hardness scale you choose to rest. Rawhides, as long as they're not the enormous bone-like rawhides, are quite a good option. So that's probably the place to start. All mammals with teeth, if they have plaque on the teeth, the plaque is bacterial soup that coats the teeth, they will get inflammation in the gum. That's gingivitis, and that's the first stage of periodontal disease, which is inflammatory disease of the supporting structures of the teeth. So if you just leave that alone, different individuals will go through the process of losing bone and supporting structures of the teeth at different rates. So for instance, tiny breed dogs, that tends to go at a much faster rate for a number of reasons. So my suggestion is assume that your dog needs to have their teeth brushed and get going with daily toothbrushing. My suggestion is that you go through a training program rather than a wrestling match, and we do have a handout material on how to go through a training program to get your dog into toothbrushing. If you want to contact us, we can send that to you. I suggest that you don't use toothpaste because toothpastes are all flavored and then they're rewarding your dog for whatever behavior, whether it's running laps of the room with the toothbrush in their mouth laughing at you or whether it's sitting quietly, they're still rewarding themselves. I also suggest that you don't use the dog toothbrushes that you can buy. And the reason for that is that they all have very hard bristles that are really uncomfortable for a dog. I would go to the pharmacy and buy a small children's toothbrush with the softest bristles you can buy. I would attach your daily brushing to something that you already do with dogs, because most toothbrushing regimes falter because people forget to do it. So for my dog, we wake up, we go in the garden, we run around, we pee and poop, we have our teeth brushed, we get our breakfast. It's just what we do every morning, so it always gets done. Professional tooth cleaning is essentially, it should be your visit to the hygienist. So we all brush our teeth every day, but we still go to the hygienist to deal with the bits that are accumulating tartar despite our best efforts. It's also a very good excuse to have a full checkup in the mouth. So the answer to the question is as often as your dog needs it. Now in some dogs that might be every 5 years, and in some dogs it might be every 6 months. So I would take the advice of your veterinarian about how often that needs to be done, and every time you take your dog in for a checkup, make sure your veterinarian looks at the teeth and talks to you about where you are in terms of needing professional cleaning. Well, how old is the same question. It's what your pet needs. So some dogs will need to have a professional dental cleaning at 18 months old, and some will need to have it when they're 12 years old, and it's entirely down to your dog. Obviously, some dogs are predisposed to getting periodontal disease, so plaque-related problems. So smaller breed dogs or dogs with an altered face shape, so dogs with a squashed-in nose or different jaw lengths, they will need treatment earlier, because as soon as you move teeth out of the sort of basic wolf anatomy, things start to go wrong. If anything else worked as well as toothbrushing does, then we wouldn't brush our teeth, we'd be doing that. Having said that, if you really can't persuade your dog to have their teeth brushed, or you just can't get into it, there are a number of other products that you can get that will help. And there is actually an organisation that was set up by the American Veterinary Dental College to look at the claims of various plaque and tartar reducing products and assess whether they actually work or not. And you can find the list of what's been assessed at vohc.org. vohc.org, that stands for Veterinary Oral Health Council. So what I would suggest is that if toothbrushing is really a no-no, and you've looked at the training program and you just don't think your dog's going to buy it, then use 2 or 3 of the products off VOHC and see how much help that gives you. If your dog is highly predisposed to periodontal disease, so a Chihuahua, a small breed dog, a boxer, a dog with different jaw lengths, then you will not succeed as well as you will with your German Shepherd type dog that has essentially the same skull shape as a wolf. So we've probably already established that the breeds that are prone to gum disease, to periodontal disease, are dogs that have moved a long way from the basic wolf head shape and size. So smaller breed dogs, tiny breed dogs, miniature tiny dogs, extra miniature tiny dogs that sit in your hand. As you go down that route, you get more and more predisposition. And dogs with altered face shape, so dogs with short upper jaws or any change around that, bulldogs, boxers, Frenches, all those breeds. Young puppies tend to be very chewy because they have some discomfort with teething, and just because they're little maniacs who haven't been trained to know better. So provide them with plenty of soft chewing material. I wouldn't recommend giving hard stuff to puppies to chew, because they can quite easily break their teeth on them, and that can get infected and cause damage to the permanent tooth, which is developing right beside the root of that baby tooth. Well, thanks for joining me. I'm glad I could answer some questions on dentistry for you. We deal here at MASH with all different types of dental disease. We also deal with a lot of trauma cases where dogs and cats have had damaged faces and skulls. That's a lot of what we do. We have what's called the Craniomaxillofacial Trauma Centre here. And getting good treatment for those cases is really important, because there are a lot of things that can go wrong with that. We also do a lot of oncologic surgery, so surgery for dogs that have cancers in the mouth, which we do in conjunction with our oncology colleague here.